Hi guys, my name is Noelle Miller and my presentation is titled World War III PTSD. I will be talking about the effects that PTSD has made on soldiers and the war inside their minds. The reason I chose this topic is because it greatly affected Europeans along with American soldiers. Mental illness is a very important topic, so I chose to specifically focus on PTSD and shell shock. PTSD during World War II. PTSD in the World War II combat veterans presents with physical, psychologic, and social manifestations. Specific physical problems such as traumatic arthritis and digestive disorders may be linked to POW experiences. Psychological symptoms include denial, numbing, intrusive images and thoughts, and nightmares. PTSD affects 7 out of 100 veterans in their lifetime. The challenge of trauma is not only dealing with the past, but even more enhancing the quality of day-to-day experience. One reason that traumatic memories become prominent in PTSD is that it is so difficult to feel truly alive right now. When you can't be fully here, you go to the places where you did feel alive, even if those places are filled with horror and misery, such as war. This is the chart that the soldiers rate their pain when coming home from war. A 0 is no pain for the soldier or no PTSD. A 10 is as bad as it could be. It affects the soldier and nothing else matters in their life. 5 is moderate. It interrupts some of their daily activities. And an 8 is awful, hard to do anything. This is a video with soldiers and PTSD and shell shock.
When we got a patient in, we got their health record. If they had been in extreme conditions, they were more apt to be battle fatigued. It's called PTSD.
When I come home after service, one of my sisters asked me what was I shaking for. And I said I didn't know I was shaking. I tried to eat, and then time I get up here, beans and everything else is all shook out of a spoon. And I went to the doctor with it. And he said it's probably related to Pearl Harbor.
I didn't get any wounds, no wounds at all. But what happened to me is I started shaking little by little. After each battle, I started shaking a little worse until toward the last, I couldn't even write my name. They wanted to send me to the hospital, so I finally asked him, what kind of hospital is it? And he said, mental. And I said, I don't want to go to a mental hospital.
I had PTSD in a worse way when I was discharged, and they didn't know what to do with PTSD. They left me alone, and after a month and a half sent me home and said, don't talk about it. And that's the worst thing that you could do. You've got to get it out of your system. You've got to talk about it.
I had nightmares for many, many years, but after I opened up and started to talk about it, then the nightmares seemed to drift off, didn't come as often, and I haven't had one in a long, long time.
We all talked about Pearl Harbor a lot, and we made speeches on Pearl Harbor. The whole idea of making a speech was to help us get rid of the hatred in our hearts and the memory of what happened.
Alright, as you could tell from that video, many of the veterans explained that talking and talk therapy really helped them relieve themselves of those very traumatic experiences that they experienced in war. Next, I'm going to be talking about W.H. Rivers and all of his studies on shell shock, which is a very famous study. It was the study that was done before PTSD was later developed. Alright. The English psychiatrist and anthropologist William Hulse Rivers, aka W.H.R. Rivers, famously treated British officers suffering from shell shock by revolutionary methods known for their humaneness. These included talk therapy and autognosis, which were influenced by his own physiological and ethnographic research, as well as his studies of psychoanalysis and evolutionary theory. Talk therapy is a type of treatment that focuses on relieving the patient's pain through talking. This therapy can potentially relieve emotional distress and mental health problems. Many soldiers from World War II engaged in this, and it helped relieve stress when they talked with other survivors of the war, more so than talking with a therapist. I believe that the reason that the survivors like talking with other survivors is because they have somebody who can relate to them and their experiences. Rivers, an extraordinary gifted child raised in Kent, graduated from medical school at the University of London at 22, where he began working at the National Hospital for the Paralyzed and Epileptic at Queen Square in 1886. He encountered physical treatments similar to those advocated by Kaufman. As these treatments were often ineffective, Rivers became interested in developing them and even predicted the symptoms of hysteria would in time be associated with molecular delirium and its allied conditions such as hysteria and neurasthenia, perhaps indicating a budding interest in physiological therapies. In 1908, Rivers published The Todas, an ethnographic study on the Todas inhibitions of southwest India. In his writings, Rivers demonstrated a deep consideration of the evolution of the mind. He referred to the growth of the human intellect as a continuous addition to a sequence. In other words, basic instincts were not removed through evolution, but instead pushed aside as newer, more complex instincts form. These theories were similar to the famed neurologist John Hewlings-Jackson's theories of evolution and consciousness, published only a few decades earlier. Jackson believed that the nervous system consisted of levels that had been laid down at different evolutionary moments, and that these levels corresponded to functions rather than anatomical structures. In 1915, Rivers moved from Queen Square Hospital to work at Maghole War Hospital. Maghole, at the time, was in the midst of transition. Its director, neuropsychologist R.G. Rose, had undergone an intellectual conversation after reading Freud and became determined to develop Maghole in a psychological direction rather than along normal lines. At Maghole, Rivers conversed with psychologist T.H. Pear about psychological medicine, Hewlings-Jackson and Freud's ideas, and anthropological theories. In a memoir, Pear recalls Rivers' intense interest in Freud on arriving at Maghole. Rivers' first desire was to grasp what Freud meant by the unconscious, which Rivers thought was the most important contribution to psychology in a long time. Freud's approaches to psychotherapy and searching for unconscious conflicts of the mind seemed revelatory to Rivers. Most doctors treating shell shock who rejected an appeal to physical etiologies were not sympathetic to complex physiological explanations or even basic psychotherapies. Symptoms could be recognized as emotional, but the best cure was considered hard manual work or breathing exercises. Most doctors also suggested that patients with shell shock actively try to repress and forget their war experiences. Yet, Rivers also distinguishes ideas from Freud's premises and developed his own ideas. In other words, Rivers believed that memories were repressed because there was a conflict between the mental tendencies of the individual and the transitional code of conduct prescribed by society, instead of sexual strivings like Freud described. Next, I'm going to be talking about Sigmund Freud's advances in mental health. Many psychologists, for example, Sigmund Freud and W.H. Rivers, developed studies on mental disorders starting in the late 19th century. Leaders that started developing the framework and basis for measuring things such as neuroticism were discovered by Sigmund Freud and his colleagues. Many people who struggled with PTSD or any sort of mental illness before this were often jailed or put into asylums because people were very against any mental illness at the time. And it was very sad. Sigmund Freud was born in Freiburg, Moravia in 1856. Freud dedicated his life to many famous psychology studies that really changed the psychology field. Freud was famously known for his psychoanalysis method. This advance in psychology helped psychologists understand their patients' unconscious conflicts. Psychoanalysis sought to bring unconscious information into the conscious awareness in order to induce catharsis. Catharsis is an emotional release that may bring out relief from psychological distress. Freud wanted to understand his patients and help them because he himself had faced anti-Semitism during World War II. He lived in Europe and he was often harassed because he was Jewish. This only made Freud want to make a difference, and he did that for many psychologists in the field of psychology overall. How World War I helped advance World War II PTSD diagnosis. The extraordinary capacity of the human mind to rewrite memory is illustrated in the Grant study of adult development, which has systematically followed the psychological and physical health of more than 200 Harvard men from their sophomore years of 1939 through 1944 to the present. Of course, the designers of the study could not have anticipated that most of the participants would go off to fight in World War II, but we can now track the evolution of their wartime memories. The men were interviewed and detailed about their wartime experiences in 1945 through 1946 and again in 1989 and 1990. 4.5 decades later, the majority gave very different accounts from their narratives recorded in their intermediate post-war interviews. With the passage of time, events had been bleached of their intense horror. In contrast, those who had been traumatized and subsequently developed PTSD did not modify their accounts. Their memories were preserved essentially intact 45 years after the war had ended. The Traumatic Neurosis of War, which had been published in 1941 by a psychiatrist named Abraham Gardner, it described Gardner's observations of World War I veterans and had been released in anticipation of shell-shocked soldiers expected to be casualties of World War II. Gardner reported the same phenomenon I was seeing. After the war, his patients were overtaken by a sense of futility. They became withdrawn and detached, even if they had functioned well before. What Gardner called traumatic neurosis, today we call post-traumatic stress disorder, aka PTSD. Gardner noted that sufferers from traumatic neurosis develop a chronic vigilance for and sensitivity to threat. His summation especially caught my eye. The nucleus of the neurosis is a physioneurosis. In other words, post-traumatic stress isn't all in one's head, as some people supposed, but has a physiological basis. Gardner understood even then that the symptoms have their origin in the entire body's response to the original trauma. As part of the study, we gave participants a Rorschach test. Unlike tests that require answers to straightforward questions, responses to the Rorschach are almost impossible to fake. This test provides us with a unique way to observe how people construct a mental image from what is basically a meaningless stimulus, aka a blot of ink. Because humans are meaningful creatures, we have a tendency to create some sort of image or theory out of these ink blots, just as we do when we lie in a meadow on a beautiful summer day and see images in the clouds floating high above. What people make out of these blots can tell us a lot about how their minds work. In the test, these are the results. When we gave the test 221 additional veterans, the response was consistent. 16 of them, on seeing the second card, reacted as if they were experiencing a wartime trauma. The second card is the first card that contains color and often elicits so-called color shock in a response. The veterans interrupted this card with descriptions like, "These are bowels of my friend Jim after a motor shell ripped him open, and this is the neck of my friend Danny after his head was blown off while we were eating lunch." None of them mentioned fluttering butterflies, men on motorcycles, or any of the ordinary, sometimes whimsical images that most people see. Shell shock to PTSD. War neurosis, or shell shock, as it was referred in the 20th century, could be considered the signature injury of World War I. These disorders involved nervous ailments with no apparent organic lesion. Symptoms included paralyzed limbs, mutism, and localized loss of sensation or numbness, as well as uncontrolled emotion and male hysteria. During the First World War, 80,000 British cases of war neurosis were diagnosed, and after the war, around 200,000 British veterans were awarded pensions for war-related nervous diseases. The English psychiatrist and anthropologist William H.R., aka W.H.R., famously treated British officers suffering from shell shock through his talk therapy and ethnographical research. Before World War I, physicians and researchers believed that shell shock was due to physical injury of the nerves and exposure to heavy bombardment, and advocated a physical approach to treatment with drugs, surgery, electricity, hydrotherapy, massage, or other kinds of physiotherapy. These methods were both physically and emotionally harrowing. Fritz Kaufmann, staff physician at the Nervous Illness Station of the Reserve Infirmary at Ludwigshafen, Germany, described his approach to treating servicemen suffering from war neuritis in his writing. Kaufmann recommended a surprise attack or prolonged electrical currents combined with verbal suggestions and persuasion. He believed that by treating the physical motor symptoms associated with nerve damage, physicians could cure the psychological symptoms. Shell shock was the original term for PTSD when psychologists didn't understand the topic fully. PTSD was finally coined in 1980 by the American Psychiatric Association. These are some images from people describing war. The first one says, "Great to have you home, bro, and not a scratch on you." But the soldier obviously is suffering from PTSD, and many people just can't understand that because they weren't in the war. The second one is a picture. He seems like he's dealing with trying to get out of the war, but he can't seem to make it back to his state that he was in before the war. The left is a picture of W.H. Rivers, who I talked about earlier, and the right is a picture of Sigmund Freud. Long-lasting effects of PTSD. It is important to note that not all side effects are visible, so we need to treat them as if they are. Some sufferers of PTSD cannot reset their body to its normal state. Their body continues to function at the heightened state it adopted during the traumatic event. The fight or flight response doesn't get turned off after the danger is over. Hyperactivity, insomnia, lack of concentration, irritability, and pain and panic are just some of the effects of PTSD on victims who suffer from hyperarousal. The effects of PTSD can also include re-experiencing for some victims. Whether it is mental flashbacks, bad dreams, or intrusive memories, re-experiencing has a detrimental effect on the mental state of the sufferer. Another form of re-experiencing includes physical memories, automatic responses to stimuli that are exaggerated or out of place. Sometimes the body remembers when the mind does not. At times, the body and or mind just shut off when they cannot cope with an experience. The victim of this effect of PTSD acts like they are on autopilot, taking little interest in life or what goes on around them. They suffer from feelings of hopelessness or helplessness and cannot connect their feelings with the world going on around them. Depression, anxiety, hopelessness, and withdrawing from friends and families are all indicative of someone suffering from numbing/avoidance. And then that is my references.